with another installment of Topics in 10. Thanks for joining us. With us today is Dr. Kavita Nair. Dr. Nair is a health outcomes researcher. Her academic interests have focused on leading real-world outcomes research initiatives in the Department of Adult Neurology at the University of Colorado Anschutz Medical Campus, notably in examining the comparative effectiveness of drug treatments in the management of neurological diseases, specifically multiple sclerosis, and more recently in the rare neurological diseases of NMOSD, myasthenia gravis, and spinal muscular atrophy across a spectrum of diverse populations. Her research also extends to examining the overall disease burden for neurological conditions using multiple data formats. In addition, her role as the Vice Chair of the Coding and Payment Policy Subcommittee between national payers and the American Academy of Neurology, and her local advocacy work in prescription drug policy legislation in the state of Colorado has helped create reform-based policies that increase patient access for neurological drugs. Thanks so much for taking time out of your day with us, Kavita.
Thank you so much, Kelsey, for having me.
Absolutely. So we're going to get started. We're going to cover this whole topic of insurance information and your MS drugs in 10 minutes. Are you ready?
It's the only way to do it. I would start with kind of understanding the kind of medication you're getting. And the reason I say this is MS is a wonderfully plentiful market. We have over 23 drugs. And MS is also defined by the fact that you can get drugs in different delivery forms. So you can have an oral pill, you can have an infusion that you can take, twice a year, an oral pill that can be daily, just like popping any of your other vitamin pills. You can have an injection that you can take at home, that's once a month. You can now have an injection that you would need to come to your neurologist's office that you can have twice a year. And so some of that will help decide, based on your lifestyle and schedule. But the type of drug you get, the delivery mechanism, does influence the kind of coverage you have. Which part of my health insurance do I need to address? Does it need to go through a pharmacy benefit, like we do for all other non-MS drugs? If it's a pill, it's injectable. Or does it have to go through my medical benefit, like we do for hospital stays or when we go to a doctor's visit, if it's an infusion? Because that has implications for out of pocket, what's covered, those kinds of things.
What are some of the top 3 questions that newly diagnosed patients with MS should ask their insurance company?
I think the first question is coverage, right? And coverage is a very nebulous term. Is my drug covered? And that would be one of the first questions, but also to dig a little bit deeper as to what that coverage means. So here I'm going to talk about drugs under the pharmacy benefit. That's the majority. So a drug can be covered on a list called the formulary. And this is a list that's put together by a group of clinical, economic, and different experts. Every health plan does it to determine what they feel is the most efficient list. Because as I mentioned in MS, for example, there are 23 products. We would love all 23 to be covered, but health plans go, well, we can't afford to do that. And so coverage means, is this drug on that list? Which means your cost sharing, your expense associated with it, the ability to get the drug without a lot of jumping through a lot of hoops are much less. But coverage can also mean, yes, you can get it, but your provider will have to do something known as prior authorization. Unfortunately, once you have a chronic condition, prior authorization or PA becomes a huge part of your life. And so coverage could also mean it's not on the formulary. Your physician wants it, he or she thinks that's the right drug for you, and so is this drug under a prior authorization? And that requires additional work on the part of your provider, the clinic, to get approval from the insurance plan as to whether the drug can be covered. So that would be the first question, coverage and what kind of coverage. And then related to that would be if the drug is now under the medical benefit, right? You want to get infused twice a year. What kind of locations can I go to get it? But insurance companies have exceptions or have mandates known as site of care. where they will only cover infusions at certain sites. So that may be another question to ask. And then I think the third question to ask is, are there, for prior authorizations, are there other medications that I have to take first and fail? That's a term known as step therapy, before I can get this medication that my neurologist and I and my family decided together. So sometimes health plans will do step therapy edits to say, there's this medication, but we have in MS now, we have generics, and we have older medications. And so as a way of kind of managing costs, the patient has to kind of go through the hoops. And so that will be the third question.
And let's say a drug is denied, it's not on the formulary. What are some steps that patients can take to make sure they get on the drug that they and their neurologist decided on?
Excellent question. And unfortunately, we see denials very often. And the first thing to assure patients is that a denial is not necessarily the end of the road, right? There are appeals that can be done. And in the interim, there are bridge programs where the clinic and the manufacturers partner with the clinics to say, okay, so patient can't get the drug, it's been denied. Your MS doesn't go away based on an insurance company's plans. And so there are ways in which there can be a bridge amount of drugs that are given for a certain amount of time until the insurance process is played out. In fact, in 2025, I would say the MS companies have taken it a step further and say, when you write a prescription for a new drug, it takes time to go through these processes. And we don't want the patient to necessarily have to wait by the time they get the insurance approved, and if not, a prior authorization. Now we're talking, a couple of weeks, maybe a month. We may help to start the patient with a starter program. Get the drug now for an X amount of time while your prescription request is being reviewed by your health plan. So there are several ways, and in my experience, all the MS neurologists work very hard, and their staff, to make sure that there's no gap in coverage. And if it's denied, there's appeals. We take it all the way to the levels we need to make sure that drug, which was decided by you and your neurologist, is there for you.
And how do patients go about accessing these programs from the manufacturers?
Yeah. Most manufacturers of brand name drugs, now keep in mind we have some generics as well, will offer what's known as copay assistance programs. And by and large, the way to go about it, so if the patient meets with the neurologist and they decide on a drug, there is a patient enrollment form that is filled out with information that is then sent to the drug company. And I just want to be very careful to say none of this is giving your information away. It's a way for these companies to put their information, the patient's information, to see if at some point are they eligible for drug assistance, or do they need bridge funding. So this is very compliant. It may feel very strange. And then as the patient starts their process of, okay, I want this drug. Now, do I qualify for it? Do I get the PA? The drug may be denied. How do I get this drug? They go through this life cycle we just talked about. That's when we reach back out to the pharmaceutical companies. And the patient assistance programs are almost always run from a foundation standpoint, separate from the other operations, and say, okay, this is what's happened with this patient. Can we get some assistance in getting free drug or getting a reduced amount of the drug? And so that's one way in getting it.
Another way is, when we think about out-of-pocket costs, we sometimes think about our copays, but the majority of us have deductibles that need to be met. And so it's not just the cost you pay for your prescription. If it's for an infusion, it's not necessarily just the cost for the infusion. The cost of care can include the cost of someone administering the infusion, but it can also be your deductible that needs to be met. I know for my own health plan, I have a $10,000 deductible. And if you're an MS patient, you're going to achieve that or accomplish that very quickly. So the other way to get copay assistance is that industry and other groups, it's not just industry groups, you have charities and foundations, would provide a certain dollar amount to say, for X patient, we will provide hypothetical numbers, we will provide $5,000 a year to be used to help with that out-of-pocket costs. And so if your deductible was $10,000, $5,000 of it is covered. By and large, the amounts of these copay assistance programs tend to overlap very nicely with out-of-pocket costs. The copay assistance does not apply to Medicare and Medicaid patients. Medicare patients cannot use any copay assistance to apply towards their out-of-pocket costs, the out-of-pocket maximum.
How can patients estimate their share of out-of-pocket costs?
Most MS clinics, there is someone in the clinic who is helping verify your benefits. There's usually a nurse navigator or a patient navigator. Some of the navigators are from the company that provides a drug, or maybe because they have the resources to do so, that can work with you to estimate until the point of sale as to what the cost of that drug is. Because you don't want to be surprised. If there's one thing I've learned after being in the MS community for 15 years, it's an incredibly integrated or supportive community. So when in doubt, just ask and ask.
So that brings up the really great point of, if you are concerned about the cost of your medications, have that conversation with your neurologist. Start there. They don't know what's wrong if you don't tell them.
Excellent point.
Thank you, Dr. Kavita Nair, for taking time out with us. I know this answered a lot of really important questions and cleared some things up for patients. So thank you.
Yeah, thank you again.